Thank you very much. Maria, you are representative here in the European Parliament with the political element at your back, and I know you're personally very involved. So please, I'm going to hand the floor over to you for some concluding remarks to give us your aspirations going forward.
So first, thank you very much for the invitation to conclude this event. First, I would like to add my sentence, the 15 seconds sentence that are very much in line with the Irene, but I would add to shorten the time that takes the fantastic results from science to be transformed in solutions for the patients and the ones that suffer. We can still shorten that period of time, and that is something that I would like IHI to deliver during the next years. So I'm very happy that I'm in the launching of the IHI after two very successful editions of IMI. And as colleagues later, we had invest most of our, at least in our area of ITRE, we have invest most of the year of 21 to finalize the instruments inside Horizon Europe. And today we can say that everything is ready. The first calls of Horizon Europe are already launched. We have the EIT that has also launched the first kick in this new era, and also the partnerships are all preparing for starting the work of the next years. I had the privilege to lead the work in the European Parliament, both in the strategic agenda of the EIT and on the partnerships. As for example, I was the rapporteur of the strategic agenda of the EIT and also the rapporteur of the package, because it really was a package of the Single Basic Act with 9 partnerships where IHI was included, also the public-private partnership, the metrology, and one extra that was separately on the high performance computing. So I'm very happy that now the work is finished, was very successful, our part in the European Parliament, and you can start now doing the work. I'm particularly attached to these to the partnerships, because in 2008 I was principal advisor of President Barroso, and I had in charge it was called the innovation package, where IMI1 was launched. I remember the launch of IMI. I was with the president in that launch. And after, between 2012 and 2014, I was not the rapporteur of IMI2, was a colleague and a friend of mine, Mrs. Teresa Herrera Madurell, but I was in the package because I was one of the rapporteurs of the EDCTP, now called Global Health, and we dealt with all the partnerships in the package. It was not only one rapporteur as this time, but we worked together. So I have followed quite closely the work also of IMI2. And one thing that I want to congratulate IHI, and I don't know if this is obvious to everyone. I know that the ones that are really inside the system, this is obvious, but not probably for the general public, is that the process this time of the approval, both mainly in Parliament, but also in Council, was much smoother. There is a much a better acceptance for the policymakers from all the political groups of the partnerships in general and the IMI in particular, that has increased with time, the acceptance, and that this is an important model, is a good model, and the real value to health and to the society in general. So it was really very well accepted, my report. I had an easy task for the negotiations, and I remember it was not always like that in the past. So I think that this is a success of the good results that these partnerships in general have shown, and in particular the IMI being, for example, involved in the Ebola, as it was already said, in many other processes, but the Ebola vaccine is a quite visible one, and the EDCTP in the first ever malaria vaccine. So there are very concrete results that we can show and say that if we were not working together at European level, and if we are not working together, private and public institutions, we will not be able to achieve these results. And that was very important. And as rapporteur, I had my life in certain way easier than my colleagues had 7 years ago, I would say. And now we are in a very important moment for research and also for health. One thing that probably is not so visible for the outside world, but we have a lot of intensive discussion of the future of Europe. And one of the points many colleagues are defending, including myself, is that two of the areas that we should stress in the future of Europe for more Europe, where we need more Europe, is exactly on science and in health. In science, because we need to collaborate more inside Europe, more than we do today. We need to share more, sharing data, sharing knowledge to have stronger and more synergies, what is going on at the member states level and at the European level in health in all sectors, but in particular in health. And in health, we have done the first steps. It was already mentioned here with the European era, with the EU for health, with the pharmaceutical strategy, but in my opinion, is not enough. We have to go further, and I'm pushing always the discussion that probably would, something that I have defended since I was rapporteur in Horizon 2020. I would very much like to have a better cooperation of on the more fundamental research on health at European level, something like a European Research Council for Health inside the European Research Council, or a separate European Research Council. That I think would be something that we would, all the Europeans would benefit a lot. And I'm pushing, and a lot of very good colleagues. The present Vice Prime Minister of Belgium was a very big supporter. She is a very big supporter of also this proposal, and I will keep fighting for more collaboration, also at a more fundamental collaboration at the fundamental research in health. And now is the right time, because for us that have been academics or policymakers in the area of science, is very obvious. But for the general public was not so obvious. But if there is a positive, I'm not the kind of people that see the positive points of COVID, but I see one that is the realizing in general terms, the general public realize the importance of health and the health collaboration at European level and also international level. So that makes the right times for to put forward more Europe into the research collaboration, into the health research collaboration in the domain of health. And second, that I want to stress is that the IHI, what was our contribution in the European Parliament for the formulation of these partnerships, that is different, as it was said here before. It's different from the IMI, And what were the points that we have stressed in the European Parliament and that we managed in the negotiation? Even was not a co-decision file, but as we managed together with the public-to-public partnerships that the co-decision, we managed to have some to have influence in the final decision. And there are points that we consider very important that are included and that were pressed by the European Parliament. And the first one is openness, transparency, and inclusiveness. Was already said here. It was said in terms of openness to the patients, but we also include another concept that was openness to partners. So we had many complaints still that the previously IMI was still very close, mainly for the countries that are more peripheral, for the Eastern European countries, for the smaller institutions like SMEs, smaller research groups, smaller universities that are more distant from Brussels. So we have included several amendments to push this inclusiveness. So keeping excellence and quality as a criteria, but make it open to new partners. And we hope, and I will tell you, this is something where the European Parliament, my colleagues are going to be quite vigilant on that we don't have partnerships that are close to the groups that are very much in the Brussels sphere, and they open up to have a better geographical balance, keeping excellence the criteria, but we know that we have excellence, fortunately, all over Europe. The second, we try to simplify, to have less bureaucracy, not as much as we could, because in the end, some rules are there because they have, the rules are there, but there is a justification, and some cannot be just erased like this, but we try, and was something that we were very keen was to have a simpler structure and the simpler rules. After, we want a link to science, to have an holistic approach so that you better capture the scientific results that are produced inside Horizon Europe, everywhere in the member states, and that is very, very important. And that is also related to the synergies that we have been talking here. We think that is still a lot of work with the synergies, mainly with what is going on in member states, what is financed by regional funds, recovery and resilience plan is still not an easy way to do these synergies. I know that the DGRTD is working on that. And last, because I'm finishing the time, we ask the IHI to increase the visibility. Still a lot of people outside Brussels that do not know the fantastic work that you are doing. In the member states, I have talked with many people from the member states. It's general for a lot of partnerships, but also in your partnerships, you need to communicate more. You need to have a strategy to give information to the population, not only in Brussels, but also in the member states. So I have stressed what we want to see in the new IHI. So I wish you a lot of success. It's a lot of work, and congratulations for and a good start. Thank you very much.
Thank you very much, Maria. Very comprehensive wrap up there. And thank you to our audience, many hundreds of you tuning in today. I apologise, we've gone about 15 minutes over time, but we did try to answer as many of your very, very detailed questions as possible. Please have no fear. A lot of those presentations will be coming back to you over the weeks and months. You'll be able to see Hugh's slides as well from this morning's presentation, and we will have Q&A sessions on specific calls as the time arises. So thank you very much for your attention. Thank you to all my wonderful speakers and panelists. Keep sharing using the hashtag WelcomeIHI, and I wish you a wonderful afternoon and the best of your week.